Best time of my life away.
Yeah, mine's still.
I still have 4 minutes. We tried to have one this morning at the nursing home. And because it's an hour drive for my brother to get here. And I just kept getting cut off, so I finally said, you know what? You just talk to them, call me later, that's what they said.
Oh,
How's your day going?
probably good. No.
You could just pick whatever seat you want, Floyd, around the table. What about myself? I wouldn't recommend it.
How we doing?
Baby boy, baby girl.
Boy.
And
And well, both,
and your
yeah,
baby girl.
yeah. They're doing great, dude.
Okay, by 6:30, so you can call me into order. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call.
Beth? Here. Busher? Platt?
Here.
Dill?
Here.
Holcombrink?
Yes.
Mathena? Here. Miller? Benetta? Watkins?
Okay, motion to approve the agenda.
I'll make it. I'll second. sorry, Beck,
Yes.
Dill,
Yes.
Falconbrink,
Yes.
Messina,
Yes.
Watkins,
Yes.
Platt.
Yes. Okay. A motion to approve the minutes from our November 1st, 2021 meeting should be in your packet.
I'll make the motion.
I'll second.
Actually, I don't know if you can, you weren't here, right?
Oh, I can.
Yeah. Beck,
Yes.
Dill,
Yes.
Falconbrink,
Yes.
Messina,
Yes.
Watkins,
Yes.
Platt.
Yes. Introduction of guests.
I was there.
Right.
Yeah, you were there.
Any public comments?
Anybody fill the paper out?
So then we can move on to new business. Fiscal officer's financial and staff time report should be in your packet as well.
I have two financial reports in there, so the first one is as of 1/19, to tell you where we're at the start of this fiscal year. And it, on the second page there, it says how much we have in checking and our reserves, and you know where we're at. Then the second report I have in your packet, at the top right-hand corner, you'll see that, it says fiscal 20-year, final report. This is what I give you every year, so that you know what we did, during the fiscal year. Fiscal year means December 1st through November 30th. Joellen and I matched exactly, so I went ahead and printed it for you, but this has not been completed by the auditors. But I give it to you every year in January, just so you kind of know, no matter how long the audit takes, that Joellen and I's reports both match. Okay? Anybody got any questions on those?
I just had a question about, so the local health department is not doing the tracing anymore, is that correct?
Partially.
Okay.
When anybody tests positive, it goes to what's called the surge center. And then Chris and I every morning, more so Chris than me, but we will go in, anyone that's in the long-term care facility, over 65, school staff, then we have the ability to pull them back to us, so we can still do the contact tracing.
Okay, so that's, I was just curious about the tracing grant fund, how that worked with all of,
No, that money stays with us. Now, whatever we don't expend by March 31st, will go back to the state.
Thank you.
And then I have the, monthly time report where you see the employees' PTO and sick hours and stuff. It does look a little different this time at the bottom, because everybody January 1st gets their new hours. So we kind of tried to explain at the bottom who got what hours. It all goes by how many years you've been there, okay? And then everybody gets 80 hours, sick time every January 1st, so those are all in there also. Okay?
Anybody have any questions? Okay, seeing none, we can move on to the administrator's updates.
Okay, I gave you a handout. The first sheet is the total number of cases that we reported today. It also was out on our Facebook. Cumulative, we've had 3,205 cases. We have 100 currently active in isolation, and 22 have passed away. If you look on the IDPH website, they actually have 13 more deaths than what we're reporting at 22. We don't like to report them until they come into our office with the death certificate, until we see that. So Julie reformatted it a little bit this morning, that we're awaiting 13 additional confirmations from IDPH. And then she did break it down by age group. The second page is the graph. It started in January of 21 when the first vaccine rolled out. And this is just Cumberland County. And it goes all the way through today. And you can see there at the beginning, we had first dose, second dose, so we had a lot of upticks there. And then all the way through November to January, and we do have vaccine back in stock. So, we have a clinic last week and we have another one scheduled tomorrow. So hopefully get in before the weather gets here.
Did you give Mary any last week?
I believe she gave 8. The next page is a breakdown by county for the contact tracing. On the contact tracing grant, whenever we received notification of positive cases, they wanted us to call them within 24 hours, and then their next goal was 48 hours and 72. And that was one of our grant deliverables, that we would meet those call times. And you can see that we were at 99.58% on cases attempted. And then for the cases interviewed, we were at 96.88%. Now, this data is from August 1st of 2020 through January 8th of 2022, because the system we now use for contact tracing wasn't purchased and utilized until August 1st. So if you look at the total number of cases that we have on what we put on Facebook, they don't match, because we had a lot of cases from March 13th of 2020 until we started using this system. And they did not require us to go back and put all our notes in that other system. And if you look at some of the other counties, I'm really proud of our percentages.
Some of these are bad.
Yeah, so I think,
Because of the Cook County.
That's what I was thinking.
so we're a little disappointed with the surge having so many of our cases, because we're getting a lot of reports that they call and, you know, they're not as friendly as us, because we know people that live in the county. So we're trying to get as many back as we can.
My family member, they didn't even pick him up for 5 days.
Yeah, and that's-
I mean, he was out of
Yes.
quarantine by time they finally contacted
I
him.
know personally, I do the COVID at home stuff, and I can't tell you, I mean, I'm at probably, in the last 7 days, I've treated about 50 patients, and I can guarantee there's only been like 3 or 4 that have been contacted by the health department. in that time frame. So that's pretty impressive.
And that's why we have that really big surge within the county, and as we're coming back out of that, we want to start bringing more and more back. And enough health departments are pushing back on that. I think we're going to see the capability for us to do that.
Like what you said, we know the people, and we know they need their excuse letter for school or work, and they need their release letter for school or work. And the surge just,
No, they don't care.
they don't, yeah.
And we know family members,
Yes.
or, some of the interactions between, or where they may have been together in an event, so we can kind of to look for that. Whereas they may make a call to the husband, and then another person over here is calling the wife, where we would know that family,
Exactly.
so. Okay, any questions on contact tracing?
And currently you have 11 contact tracers. Is that right?
11 plus my staff.
Okay.
We're all
Yeah, I was
trained.
gonna say, wait a minute, we
Yeah.
have
And you said that,
17,
and
yeah.
that grant still goes through March, so we're good for,
It goes through March, and we can talk about that too.
Okay.
We have some other grants that allows us to move it over, contact tracers over to the other grants.
okay.
How much money's left in that so far, Sherry?
Um,
How much is in the contact tracing grant still?
let's see. I don't have it. It's in your packet.
We still have 28, no, we're way over. Because see, we only budgeted, I have my glasses on, I'm still having my time. We only budgeted 5,000 because we thought it was gonna end. It was supposed to end December 31st, 2021. So I'd only put 5,000 in the budget because I thought we'd just have 1 month, and then they've extended it all the way to March. So I'd have to look at the office.
According to this, you've got 25,000 somewhere.
No, this is income. See, this is income. So you gotta look down here at tracing, and how, see, we're over 660%,
Oh, I see.
Because, like I said, we had been told it was only going through December 31st, 2021. And that meant I only had 1 month in this fiscal year, but now we have all the way to March. And I'm not gonna revise that part of the budget yet because we don't know what kind of money we're talking about, and so I'd rather wait and see what it ends up being before we revise it and have to revise it 2 or 3 times.
Any more questions on contact tracing? Okay, the next 2 sheets in your packet there are the COVID-19 testing data. The first sheet is December 1st to the 31st. At our office, we conducted 151 tests, 40 were positive, 111 were negative, and that gave positivity rate of 26.5. But that's only in our office, because there's other places that they can get tested. And then the second is from January 1st through the 31st. We tested 425, 132 positive, 293 negative, for 31.1%.
And it's been crazy there.
Yeah. We had one day where we did 60 tests.
In 2 hours.
Yeah. 2 hours.
Yeah.
They were down the block, 2 blocks.
I think it's been slightly busy at the school too.
Do you guys have tests? Like, I know that was,
Yes.
tests are available, like, you're getting an appropriate amount and everything.
We
I know they were,
It was close there for a while.
We were close, and then when the shortage started, Binance now went back and they reviewed all of their extension dates of virtually everyone that we thought was expired has now been extended, so. Yeah. Something? And like Jill said, both school districts, have nurses in that are testing the staff and occasionally the students, I believe, for test to stay. Yeah. They have their own CLIA, so they work under their own CLIA. And it really does help us out quite a bit. And then the clinic over here, she'll do the rapid test, because we, as a partner, we provide them the test kits, so. Any other questions from you on that?
You're doing a good job keeping up with it all.
It's, the service itself isn't what takes the time, it's all the paperwork that really bogs us down. And that's all I have.
that's all I have.
I have a question.
Mhm.
You say you got vaccines now again.
We do.
How long were we out of vaccines? How long period of time?
We ran out, I believe, the 1st of October, November and December.
First of October you ran out?
November.
First November. So you got all of November, all of December, and half of January.
We got a stock in on the 11th of January.
Okay, so 2 months. What did you do to get the vaccine in, or did you do something? You made a phone call or something, did you?
We're in the process of being renewed for our vaccine, the BFC program, and that is a lengthy process. And we are just about to get finished with it. The FQHC that has to sign off, they signed off on the paperwork Thursday. We got it on Friday and submitted it. We still have to do calibration one more time on our new freezer and refrigerator and send that, and then we have a couple of certificates of training that has to be uploaded, and we should be renewed. And I did call the chief immunization deputy at IDPH, and she was able to go in and see where we were in the renewal process, and she was able to let us get 200 doses of the vaccine.
So you got that vaccine because you made a phone call. Otherwise, it still wouldn't be here, right?
No, because I called and asked her, since we were in the process of it's called deputization, where we're deputized to get the vaccine. And it is a process, as Jeff Workman from Effingham Administrator, he also explained that to you, I believe. It is a process,
Yeah, okay.
so.
I just don't know why we're out of vaccine for 2 months ago. That just don't seem right. I don't know. Will that happen again?
Well, I hope not. because our renewal will be good for a year.
Okay, it just seems kind of odd we're out of vaccines, and all the pharmacies all have vaccines, why we couldn't get it like they did?
Well, part of public health is that we partner. And all along, our partners are like the clinic in Toledo, the pharmacy in Toledo, the yoga pharmacy. And anywhere you go, you will see a lot of people offer the vaccine because they have partnered with us. And so, as you can see from that chart, Cumberland County residents did not go November and December without getting vaccines.
There's vaccines available, I mean, they should
Correct.
have somewhere inside the
Correct.
health.
Yes. They're-
I was at the Kramer Pharmacy at the top of the day, and I asked them, do you have their COVID vaccines? Or yes, we do. Okay, well, what happens if you run out of vaccines? They said, well, we don't run out.
No, they have state contracts.
Okay, so they said, we run a little, we just order some more. It may sound very simple, but we're not quite that simple.
Yeah, the pharmacies are big, like CVS, Walgreens, all of the pharmacies, when they first started, local pharmacies, we had to sign off from the health department for them to get their vaccine. And then as it progressed and they started getting the contracts with the state, then the pharmacies took it over upon themselves because they have the contracts. So, but we are moving forward because we have vaccine now.
Good enough.
Any other questions for Sherry? Okay. Next thing on the agenda is discussion and motion for overtime pay for 1/1/2022 to 12/31/2022.
In the past, we've done it like on a quarterly or every 3 or 4 months. The last sheet in the packet I gave you, we have 4 grants that allows overtime to be paid. That's the COVID contact tracing grant, the COVID-19 crisis grant, the COVID-19 response grant, which is a new one that we just got, and then the COVID-19 mass vaccination grant. The mass vaccination grant was extended to December 31st. But each one of those grants, overtime, hazard pay, contractual employees, anybody that we need to, get the response, are covered through these grants. And rather than come every 3 months to ask for the overtime to be approved, I would like a blanket approval so we can go ahead and get it turned in when Cindy does her reimbursement request.
Do you foresee a lot of overtime or normal overtime in this future?
From January 1st to now, we have 54 hours for all staff,
For the whole staff?
from January 1st per month.
Beck,
Yes.
Dill,
Yes.
Holcombrink,
Yes.
Mathena,
Yes.
Watkins,
Yes.
Pratt.
Yes. Then we will move to discussion and motion for fiscal year 22 budget amendment number 1.
Okay, so as you can see on the top section here, I'm asking that you take 25,000 out of local health grant. And basically the next line item, I'm asking you to put that money into seasonal flu grant. Because, I need it separated for audit reasons. And at first, it all come in one lump sum, but it's actually 2 parts. And so for audit reasons, I'd really like it separated. And then the third line is the response grant we just got. So we haven't had that yet. The first 2 lines won't change the budget. The second line is going to increase the budget by 125,000. And then, the next line, 4126, is obviously then not much in expenses. Then the next line is fuel and gas, a positive 2,000. And the next line is mileage, negative 2,000. Because when we did the budget, we put it in mileage, and I really need it to be in fuel because with company cars, we're not paying mileage anymore, we're buying fuel. And so, That's why I'm asking for these amendments right now.
So what do you, go back to what you were saying about after the seasonal flu grant. You've taken it out of the protection grant, put it in the seasonal flu.
Correct.
And then you said something about $125,000.
That's the next line. The response grant is $125,000. Okay, yes, because
That's probably why.
the one thing that changed was this.
Okay.
Yes, because, yes, I had to change that because we didn't have the response grant in there. Yes, I'm sorry. If you printed that first original packet,
That's what I did.
but for tonight, it's changed to add the response grant in,
Okay.
okay? Mm-hmm. Dill,
Yes.
excuse me, Beck,
Yes.
Dill,
Yes.
Hokenbrink,
Yes.
Mathena, Watkins, Platt.
Yes. Okay, then we'll, next is discussion and motion on environmental fees.
Okay, in your package, the one sheet was approved on January 13th of 2020. And then I updated the sheet to reflect 124.22, which was when we thought we would meet last week. None of the fees were increased. Everyone has been hit hard from COVID. So after Julie and I looked at the fees, we decided we would just ask to keep them the same. You can see that under food, we have 3 categories for the restaurants. And then, an entity that is a non-for-profit or nonprofit, they can apply, they have to show us their tax exempt letter. Below that, then we have our temporary and seasonal food permit fees and a plan review. Those are our local charges. The cottage food permit, the Illinois state law is that we can only collect $25. Then we have a permit for home kitchen operation permit. We cannot charge for the permit, they just have to register with us. And then the next line, the FBI/PHI violation recheck, that stands for foodborne illness or public health intervention. If we find something that's hazardous in the facility, and we have to go back and recheck, it's a $25 fee. Then under the septics, we have the tier, depending on how far in advance they get the information to us, because Julie has to go out and look at the site prior to, unless it's an emergency, and those, no charge for an event. If they call her in advance, there's no charge. And then a permit is good for 6 months. Under the tanning, those fees are paid directly to the Illinois Department of Public Health. Body art fees are also paid to the Illinois Department of Public Health. However, Cumberland County does have an ordinance, and when we go out to do the initial inspection, the facility pays our health department $150. The water and wells, if we, the homeowner can come in and pick up the test kit and test the water themselves, it's $30. If we go out, it's $50, just because we have travel time and out of the office, that we charge the extra fee. Well permits are $150, and the closed loop well is also $150. And then the last item, well sealing, we waive that fee because we want people to seal up their wells so there's no contamination down into the groundwater, or a child or animal falling into the well and further contaminate or bodily harm to a person. So we waive the fees on those.
Okay, I remember discussing these in 2020. They're all pretty much even with what everybody else is doing, and so, I mean, I don't see any reason to increase, at least, unless somebody does differently.
Need a motion to that effect?
Yes.
I'll make.
I'll second.
Beck? Dill?
we have discussion and motion on Board of Health election of chair. Not me.
But you did a fine job.
Not me.
Do you not love talking to me so much?
That's not it at all. That's just not it at all. Has anybody expressed interest?
Adrian's not here.
That's not fair.
I think that's how I got vice chair.
Yeah.
Yeah, I think it is.
I think it is.
that is, you're right.
I do think Adri had expressed a little interest at one time, but I'm not, I can't speak for her tonight, since she's not here.
Can we text her?
I would support her. I just don't think I have enough time. It doesn't take a ton of time, but it does take time. And she's right there close to you guys
In close contact with you guys all the time.
for multiple other reasons, like not even just for.
And as you know, someday you might get 10 texts from me and then go 2 or 3 days without getting
Yeah.
anything.
Yeah, anybody have anybody else? Just nominate and approve right now, ask her later.
Will that work?
I mean, she could always say no, right? Like, we could always
And then
readdress
we
it.
can do it next time. I thought I had her in there. I think I got her on emails and not on.
Text.
Mm-hmm.
She may be watching this, maybe I will text her.
They're refusing to answer.
We just need a motion. Anybody interested?
I'll make the motion on there.
Is it Adrian?
Yes,
Okay.
Vanessa.
Mm-hmm.
Gotcha.
I'll second.
Beck?
Yes.
Dill?
Yes.
Holcombrink?
Yes.
Mathena?
Yes.
Watkins?
Yes.
Collette?
Yes. Okay. And discussion and motion on Board of Health election of vice chair.
You want to keep that?
I'm willing to do that.
Yes.
I'll nominate.
Dill seconds. Beck?
Yes.
Dill?
Yes.
Holcombrink?
Yes.
Mathena?
Yes.
Watkins?
Yes.
Collette?
I'll abstain. Okay, so then discussion and motion of Board of Health election of secretary treasurer.
It is currently Joe.
I don't particularly care to keep that position.
Joe was there.
Oh, Joe.
Yeah.
Woo. I didn't know I was that.
You said I am?
I didn't know I was that.
It's a really busy position.
It's been Joe a long time.
Well, let's keep Joe.
Yeah.
The Bush had that position today.
Yes.
He'll take it again, I'm sure.
I'll second it.
Who nominated him?
Floyd.
Oh, okay, thank you.
I'm assuming
Did
you
you
nominated
nominate
him.
him?
That was a nomination.
Well, let's say I nominate.
Okay.
Okay.
I don't know if I actually did, yeah, I nominate Joe.
I'll second it.
Okay.
Beck?
Yes.
Dill?
Yes.
Holcombrink?
Yes.
Mathena?
Yes.
Watkins?
Yes.
Collette?
Yes.
That was awful enthusiastic.
Board of Health committees.
So, if you want to see him better.
Okay.
So basically, you would just have to switch this Nick if you wanted to, or you can totally redo them.
So currently, Lisa Carlin was on the Personnel and Policies Committee. So if you don't mind, we could swap.
Yep.
Yeah. Do we need a motion for that?
No, you
No,
have
you
to
appoint.
Oh, okay. That's okay?
Yeah.
Okay, let's do that.
You want to have
Let's
one?
do that. Thank you. And then anything for executive session?
I don't have anything.
Any agenda items for the next meeting?
I know I will have another budget amendment for you because we now have another new grant too, crisis COVID grant. It's different.
Part of public health, again, we have to reach out to different communities, and so we have to show that we are doing diversity, culture, competency.
Yeah.
The whole thing, and we ideally, like our staff, we wanna hire some contractual to fulfill, someone that may go into public health in the future, or is pursuing a degree in, medical field. So we actually have, a contractual employee now that's in the mental health. She's going to Eastern as soon as she finishes at Lakeland to be in mental health. And then we have an LPN that just got his license and he works at St. Anthony's. So he's gonna fill 2 of the things that we're required to do. So they're very specific objectives and goals that we have to meet. And, you know, they watch us. We have to do an analysis of the community, of the county, and that's all stuff I have to turn in for the grant. Lots of paperwork.
Anything else for the next meeting? If not, we'll entertain a motion to adjourn.
Dr. Jill says yes, I will. I need a second.
You know, to roll call now.
No, that's the only one you don't have to.
Okay. Thank you, everybody.
Thank you, everyone.
So next time I'll have to have you sign this